I just turned on the recording, so we're recording everything going forward here. Um, Today's training is the next level down from what we did on the overview, getting into the core of the VMSG dashboard, which is operational planning. So we're going to dig down into the great details of, if you remember the pyramid, we're going to review all that, talk about the pyramid model. We're going to look at all the different variations. We're going to go into details on each level, so we have some real live examples from public health departments across the nation of, what's a service or initiative, what's a goal, what's an objective, with some live examples on that. And then at the end of this session, we're actually going to go in and enter the operational plan, the same one we used before, the tobacco cessation plan, into your dashboard so you can see the steps that we have to go through to actually do it. And then I'm going to forewarn you that at the end, I'm going to assign a little bit of homework. And that homework is for each of you to go in and actually develop your own little operational plan in the system. Very, very simple. Can be something fun, can be something business related, whatever you want to do. We've had all kinds of stuff like planning my kids' birthdays, planning my trip to Italy, all kinds of things like that, but a real simple plan. And then the next session, what we'll do is go over and review those plans just to make sure that you're understanding all the different variations and the different levels. So let's go ahead and get started here. We'll go past the horse again here. So let's review the pyramid model. So the top of the model is the organization, which is just your health department. And that's the leftmost tab on the system here. And that's typically just one entry in there is your health department. Some health departments have multiple entries for different things, but typically it's one. Each organization then has a set of groups. Groups is the basic structure of your health department. And let's go take a look at your group screen. So this is the group screen for Somerset. The department is the top level group always. It's a level 1. Anything that's a level 2 group here, you can see reports to the level 1. And then down here at the bottom, everything we have is level 2. So everything you have is reporting up to the department level. You'll see down at the bottom, we added these 2 new groups, training, sandbox, and then the Tobacco 2024 training group that we'll be working on today. So this is your typical department. These things can be added. They can be moved around. Very simple to do. We'll be getting into that when we get into the administrator training. Each group that has its own set of services or initiatives. Services, again, being ongoing things. Again, I use the example of WIC. WIC is a service been around forever, will continue to be around. Initiatives are future programs that you're going to be rolling out. And again, we're going to use the example of tobacco cessation as a future service that we're going to be rolling out. Each service or initiative has its own set of high-level goals. Each high-level goal has its own set of SMART objectives. Each SMART objective has its own set of activities. And again, we're going to go into great detail on all of these here. Now, the nomenclature that we use here, organization groups, service initiatives, goals, objectives, and activities, is fairly standard across all industries here. It is kind of the model for operational planning. However, it's not cast in concrete. And there are people out there who like to, vary these names around and move them around a little bit here. Hopefully, the bottom line is the model stays the same and the names are changed to protect the innocent, as they say. So what I'm going to do now is go over some different examples that we've seen of different nomenclature for the same model. And the reason I like to do that is at some point in time, somebody's going to hand you a plan and say, put this plan in the dashboard, and the names are going to vary in here. I want you to be able to look at that and say, yeah, I understand the plan, and we're going to be able to change the names to fit the planning model here. So let's look at some of those examples. The first one, what we call services or initiatives are called strategic priorities. Very, very common in your strategic plan, obviously. And then goals, underneath that, strategies. This is one where I don't really buy into that too well. Strategies are how we're going to get somewhere, which is more like the activities that we're going to use to get to the objectives. So I kind of think the strategies and objectives are flipped around in here, but kind of my opinion, I guess. Strategic areas is a pretty good definition of services or initiatives. Goals, I like the term outcome objectives. What are we trying to achieve in the objective level? Outcome. And then the strategies to get there. So this one's pretty good. Priorities, goals, objectives, and action steps, very, very common. Priority areas, pretty good definition. Goals, again, strategies, I think doesn't really belong there. And then action steps, or how are we going to get to the objectives. Priorities, goals, objectives, and strategies. That's pretty good. Strategies at the top. Again, I don't really buy into that one, but that's okay. Strategic objectives. I kind of like that for goals. It's a higher level than an objective. So the strategic objective, not bad. And then objectives and again, action steps. Action steps, by the way, you see that in a lot of different places, is a very common term for activities. So now what we're going to do is we're actually going to go through each of the different levels of the pyramid with some kind of real life examples here. So the first thing is the groups, and you saw your group screen, but let's look at the typical hierarchy of groups. The department is typically always the top level. It's a level 1. So the levels go from 1 to 10. Nobody's ever gotten past 5 or 6 to the best of my knowledge here. So the health department administration is typically your top level group. Underneath that, let's say you have a group called community health. It's a level 2 group reporting to the level 1 group at the department. 2s always report to 1, 3s to 2s, etc. WIC under community health, in this case, is a level 3 group reporting to community health at a level 2 and which reports to the department at a level 1. Now, let's say we did a little reorganization and we wanted to move WIC up under the department. That's a real simple thing to do on the group screen. If you have access to that, you just change the level to a 1 and you change what we call the parent group from, in this case, community health to department, and poof, it's up there at the department level. And by the way, you can do that all you want. It doesn't affect anything downstream as far as the rest of the plan goes. Your high-level plans, again, what FAB calls their 6-pack of plans, typically are groups within themselves. Sometimes they're combined together, like your workforce development plan might be part of your strategic plan. You can do that around, but a lot of times they're independent groups. Your community health improvement plan might be an independent group. So again, those are level 2s reporting to the department. In some cases, we put those under an accreditation group, which would be a level 2 group, and then they become level 3 groups. So you can do anything you want with that. And again, we're going to use the example of tobacco cessation or the Tobacco 2024 group today. Now, underneath the groups, then we have services or initiatives. And again, here's some kind of real life examples. Now, think of these as buckets, I call them, or containers for plans. So it's a container that's going to contain potentially multiple plans to get us to that service or initiative. So here's some of the, again, real life examples. Healthy moms and babies. Readiness for emerging health threats. Effective agency processes. Access to care. Behavioral health and substance abuse. Population health. Organizational excellence. Chronic disease prevention and control. Health disparities, and again, for today, we're going to use the example of tobacco cessation. So if you look at any of these, there's not a real plan per se in here. It's a container for the plans that can get you to healthy moms and babies or to behavioral health and substance abuse, population health, that sort of thing. So again, think of it as a container for a set of plans. And the plans kind of typically start at the goal level. Goals are high level, typically pretty simple. An action verb followed by a few words. So it's defining the overall, what we're trying to accomplish without the detail. So again, here's some examples. Reduce the risk of infectious disease. Promote safe and sanitary food establishments. Support communities in building resiliency. Enhance healthcare through technology. Drive health in all policy agendas. Reduce the risk of vaccine preventable diseases. Promote public health readiness and response. Promote succession planning and career growth. Integrate a data-driven best practices approach. And then again, for today, we'll use the example of reduce smoking in high schools. I like to say, if I tell you we're going to reduce smoking in high schools, that makes sense to everybody. That's pretty easy to do. What it doesn't tell you at this point in time is where are we going to start, which high schools? How much can we reduce smoking? By when are we going to do this? So there's a lot of detail below this that we need to get before we can actually say we're going to reduce smoking in high schools. And again, that is what we call the SMART objectives. Now, if you go in and Google or AI SMART objectives, you're going to get bunches and bunches of different definitions in here. Our definition is pretty simple: specific, measurable, attainable, relevant or realistic, and time-based. Now, if it's not attainable or not realistic, don't waste your time. So focus your efforts on specific, measurable, and time-based. I'm going to show you some examples again of SMART objectives. And when I do that, kind of try to pick out specific, measurable, and time-based. So here's the first example. By December 2024, identify 2 or more strategies to collaboratively reduce risky alcohol-related behaviors. So in this case, our specific would be the strategies to collaboratively reduce risky alcohol-related behaviors. Our measurement is 2 or more, and our time frame is by December 2024. So fits the model pretty well. By December 2024, 80% of educators and school staff have been exposed to ACE awareness education. By June of 2024, provide 6 training opportunities for first responders who work with individuals in a mental health crisis. By the end of fourth quarter, all programs will have established goals, objectives, and activities to be reported on within the VMSG dashboard. And then again, we'll use the example of reduce smoking at my alma mater, lovely Wayne High School in Dayton, Ohio, by 25% by the end of the school year. And I actually remember the days way back then when people would go out and steal a cigarette break, out in the back part of the high school, which kind of fell off into a little wooded ditch down there. Anyhow, so again, look at each of these, figure out what's specific about it, what are you going to measure, and when are you going to do this? Now, to get to our objective, we're going to have activities. Activities are the steps we're going to go through that we believe will get us to this target. In the dashboard, there are 3 types of activities you may remember: project-based activity, quality assurance activity, quantitative measurement activity. I'm going to go over a little bit of detail on these screens, but when we actually enter it in the system, I'll go into the excruciating detail that you'll need to know as you're actually developing these activities. But here's an example of a project-based activity. When I say project-based, kind of think of that as a project, something you're going to complete within a given time frame. Here's the first one: create training content and materials for students and faculty on the dangers of smoking. To me, that means we're going to build PowerPoints, we're going to build maybe some videos, user guides, whatever we need to go out and do the training. So it is a project that will be done at some point in time. Every activity's got a performance measure. Now, in the project-based activity, it's your responsibility to come up with a performance measure. And all it is how do I know when I've successfully completed the activity or the project in this particular case? So if I'm creating training content, once the training content is created, hey, I'm done with it. It's pretty simple. We're going to do it in a given time frame. So initially, we're going to assign a beginning and ending date. Now, over time, these things can move, as things happen in the real world. We're going to do team assignments. So we're going to assign team members and team leads. If there's external partners involved, we're going to assign them. Our measurement in this case is real simple. How far along are we, or percent complete? 0 to 100% complete is the default. And I'll show you some other options as well. So that's the project-based activity. Just as an FYI, about probably 85% of what you put in the system will be project-based activities. It's the simplest and pretty much the most effective type. There are specific times when you're going to use the other types, and we'll go over those. Quality assurance activity. Provide 9 training sessions each month on the dangers of smoking to students and faculty. So in this particular case, we have something that's repetitive. In this case, we're saying it's monthly. We call that a frequency, and a frequency can be anywhere between weekly and every 5 years. We selected monthly. And then we have 9 training sessions as our target. So since we have a target in there, we can use that target to set our traffic lights. So in this case, we're going to say, if we get to our 9 training sessions, the light will be green. And then we're going to pick some number that we think is failure, if you will. If we only get to 6 training sessions in that month, we're going to set the light to red. And then you can figure out that if it's 7 or 8 in between, it's going to be yellow. So it's repetitive, and it automatically sets the traffic light. You'll notice we have a cycle start date and a frequency. So the ending date is calculated dynamically. So in this case, May 1 through the end of May, and then we're going to move forward to June 1 and the end of June, July 1, etc. So the ending date is there, but it's just calculated dynamically based on the cycle start date and the frequency. Our performance measure will be created for you, and I'll show you how that happens in a few minutes here. In this case, our performance measure is training sessions provided, measured monthly, and our green, yellow, and red values. And then again, team and partner assignments. And as you can imagine, our measurement's pretty simple. How many training sessions did we provide? So that's the QA activity. By the way, the least used type of activity, just because it's very specific to something that's repetitive. Our third type of activity, we call a quantitative measurement activity. The only real difference between it and the project-based activity is that you have a target quantity. In this case, contact all 20 tobacco vendors within a mile of Wayne High School to ensure they're not selling to minors. By having that target quantity, it makes it real easy to calculate how far along we are. So if I said that, we've done 10 contacts, our target is 20, obviously we can calculate that to be 50% done. So it gives us the denominator to do our calculations. Just like the project-based activities can have a beginning and ending date. Because we have a little bit more information, we can create the performance measure. In this case, 20 tobacco vendors contacted between May 1 and June 30th, 24. And then again, our team and partner assignments, and our metric is simple. How many vendors did we contact? So those are the three types of activities and the three activities we're going to be working with today. Now, as you recall, at the bottom of each screen, we had that blue line, which was talking about the tobacco program. I'm going to put that in a bulletized form so you can see how the plan develops using all of those here. So our group was tobacco programs for 2024. Underneath that group, we had several initiatives in this case, and one of them was tobacco cessation. So that's one we chose. Under tobacco cessation, our goal was to reduce smoking in high schools. Under the goal of reduce smoking in high schools, we had one of the objectives was reduce smoking at Wayne High School by 25% by the end of the school year. And then there's going to be a set of steps or activities we go through to get there. Create the training content, provide the training sessions, contact the tobacco vendors. Now, this is just a small example of a plan. And by the way, the plan can repeat at any level. So you can literally start at a new group level. You can have groups and subgroups. So you could have a new group level. You could have a different service or initiative up there. So tobacco cessation would be one. You can think of a dozen other ones in there. Goal one here, reduce smoking in high schools. Let's say we're also going to reduce smoking in colleges. So that'd be a different goal because it's no longer working in the high school domain. It's working in colleges here. Then underneath that, we're going to have a SMART objective of reduce smoking at, again, my other alma mater, Wright State University, by 25% by the end of the school year. Underneath that, we would have a set of activities that are going to get us to that particular objective. And again, these can be repeated at any level. And as you go through and develop like your strategic plan, you'll have literally hundreds of activities in there as you're going through it. So that's the plan that we just talked about. Now, we have this template, and this template was attached, by the way, to the meeting invitation. You got a blank version of it. This was actually created by one of our clients in Wisconsin. What they wanted to be able to do is develop their plan offline and pass it around to their peers and get everybody's feedback on it before they actually put it in the system. You could do that, and primarily because they were new to the system and they weren't really comfortable entering the plans in the system yet. You can do it either way. You can do it this way, or you can enter them directly in the system. One of the other nice benefits of this is I can take and put this plan in the system. I'm going to basically copy and paste it in there. And you don't have to sit and watch me type for the next half hour here. So I'm going to go to the live template here. And here it is. This template, by the way, is just a Word document with a bunch of tables in it. And you can take and repeat any page. So if I want to add additional services or initiatives, I can copy and paste a whole new page in there and just continue to create the plan. One of the things I do like about this particular template is that it has a quick little definition of each level, just to kind of remind you here. So our service or initiative up here says, what bucket of work or priority does this relate to? Tobacco cessation. Our first goal, what is your, I don't know if I like pie in the sky, but high level goal, reduce smoking in high schools. Our SMART objectives, specifically, what and when do you hope to accomplish? Our objective leads are who's going to take charge of this particular objective, who's going to get us there. Our activities, what are the steps you will do to accomplish the objective? We talk about the different types of activities. Performance metrics is how will I know when I've successfully completed the activity. Our activity leads is who is primarily responsible to do and update this activity. So let's take this plan and go ahead and enter it into the training group in there so you can see all the steps we go through, and we'll talk about the different variations. So the first thing I'm going to do is highlight tobacco cessation, my initiative here. I like keyboard shortcuts personally. You can right click and copy, but I'm going to hit Control C to copy it. Now I'm going to go over to our system here. I'm down here at the Tobacco 2024 group. So the first thing I'm going to do is go down to my Service Initiative tab. By selecting the group, when I go to the Service Initiative tabs, it's going to be services and initiatives specifically for that group. So here we are, and you can see it's blank, obviously. So I've got two choices. I can either hit the plus button here or the big plus button down here, which is basically a block so that you can't type anything in until you hit the plus button here. Now I've got it in there. I'm going to hit Control V as in Victor to paste it in there. So I got tobacco cessation. We're going to call this a future program. So I'm going to hit this initiative button here. Services initiatives are very, very similar all the way through. You'll see when you get to the reporting and things like that, it'll say initiative versus services, and there's a few other things in there with dates and such, but for the most part, the plans are fairly identical. I'm going to go ahead and save that. So everything I changed down here at the bottom, I have to save to get it up, if you will, to the server. Now, one of the nice things about that is everything down here in the blue at the bottom is happening on your local computer. So what you're not doing is going back and forth. You can actually do that part offline if you had to. But I'm going to be entering this down here. The only time it actually goes up and updates the server is when I hit the save button. The reason for that is it's a multi-user system. I can have thousands of people on here, and the only time is taking a fraction of a millisecond to update the server with that. So it's a very effective multi-user system. Never slows anybody down. Down here at the bottom, you see this hide service. Let's assume for a second that the tobacco cessation program was last year's program and we have completed it. So it was the 2023 program. I probably want to keep that information for posterity's sake so I can archive it. To archive it, I just hit the hide service button here and save it. And you'll notice it grays out up here. What that means is that if you are a normal system user, defined as a normal user, you don't even see it. You don't have access to it. If you're a manager level user or an org admin level user, you have access to it. You can report on it. You can generate charts and graphs and all that kind of good stuff. But it's basically archived at that point in time. I'm going to go ahead and release it here, save that. You notice it lights up again here. So we have our service or initiative. The next thing we're going to do is go to our goals. So because I've selected this service or initiative, the goals are going to be specifically for that. And again, I'm going to open it up. Go back to our template here. I'm going to grab our goal, which is reduce smoking in high schools. Again, Control C, back over here. Control V is paste, so I use that. I'll go ahead and save that. Now, at this point in time, we can set the traffic light as well. Two ways to do that. I can either just cycle through the light with my mouse, so the gold bar, red, yellow, green, or I can use the drop down here, either one. Kind of. Somebody asked for the drop down at one point in time years ago, so we put it in there just to make it easy for anybody who wants to do it that way. So typically, if you're entering an initiative, it's a future program, which means you haven't had time to get behind schedule or anything. So most often it's going to be green. So the default is green in there. Again, I'm going to save that. So reduce smoking in high schools is our goal, and we're setting it to green. Now let's go back here again and grab our first objective. First objective is reduce smoking at Wayne High School. Grab that, Control C, go back over here. Again, because I've selected reduce smoking in high schools, my objectives are going to be specifically for that. So I'm going to go down, open it up, Control V, paste that in there. We've got reduce smoking at Wayne High School by 25%. I'll go ahead and save that. It appears up here now. The next thing we're going to want to do is say, what are we measuring? So it says reduce smoking at Wayne High School by 25%. The default, by the way, for an objective is percent done, 0 to 100%. But we can change that. And to do that, we just click on the title here. And instead of objective percent done, we're going to say percent reduction. And we're still going to measure in percent. So this percent sign down here is what appears after the field, as you can see. And then we have a choice. We can either measure decimal or percent. If I measure decimal, it's just counting anything, widgets, car seats installed, vaccinations provided, whatever it happens to be, decimal you're counting. In this case, we're still counting percent. We're just counting percent reduction. So I'll go ahead and select percent. So now you can see down here, our percent reduction is currently 0%. I'm going to go ahead and say it's 20% reduction. And I'll go ahead and save that. Now, anytime you change this value down here on a screen that doesn't automatically set the traffic light, it's going to ask you, do you want to update the traffic light based on the value you just provided? Well, our target is 25%. We're only at 20%. I might want to go ahead and set this light to yellow because we're a little bit behind schedule. And I can go ahead and save that. The light is now yellow. And if I do that, I'm going to want to put a note in here. So I can click on this little button, gives me the date, time, and person stamp. System admin would be me. It would typically say Fred Erickson if I was logged in differently. Or I can just type in a note. I don't have to have this in here, but it's nice to have, who did what when. I can say, so I'm just saying we're setting the light to yellow because we're only at a 20% reduction so far. And I'll save that. Okay, so anytime you make a change to anything over here, the current status, the traffic light, maybe even changing the objective, you're going to put a note in here as to why. The reason for that is you're probably not the only one looking at this. If anybody else looks at it, they can go in here and say, oh, I see on 9/18 at 8:29 a.m., Fred Erickson changed the light to yellow because we were only at 20% reduction. So it's a nice communication vehicle. The other thing we're going to do is assign somebody as the objective lead. To do that, we hit the little drop down here. Now you'll notice there's nobody showing up in here. The first place it looks is within the current group. So if there's anybody assigned to the current group, well, it's a training group. Nobody's assigned to the training group. So I use the show all users button up here. So it's going to show everybody in the department, as you can see down here. I'm going to go ahead and just pick Amanda as our person up here and save that. So now Amanda is the objective lead. She's got two responsibilities. Number one is she's the project manager, program manager to get us to this 25% reduction. And secondly, she's the person who's going to be doing the update down here. Now, again, we talked about the real-time planning, which is that automated email notification. So in this case, by being assigned as the objective lead, Amanda's going to get that automatic email notification, again, typically on a monthly cycle. She's going to get the email. There's going to be a link in there that'll take her back to her activities and objectives. This objective will appear on here. She can do the update. She can put notes in here, kind of anything she wants to be able to do with it to do the update on here. Go ahead and save that. When I do that, you'll notice her name appears up here. What you see at the top is up on the server. You're actually looking at the server record up there. Now, the other thing we have down here is data source. The data source is where am I going to go to get the current status on here? So if there happens to be a place on your intranet, on the internet, on your file servers, you can put a link in there to it. Let's say for a second that we could get this data from the CDC smoking cessation fast facts webpage, which there is, by the way. To put that data source in here, I just click on the button down here, and I'm going to say CDC. And that's why you don't want to watch me type. And then you're going to actually put in the link. Now, when you put in the link, you got to put in the preliminary information here. In this case, http://. It could be HTTPS. It could be FTP. It could be a link to your local servers. If you do that, talk to your IT folks and get the links that you need. They'll help you with that. And they'll also probably have to work with your firewall to make sure, because this link is coming in from an external server into your internal network. So just have them contact me and we'll get them set up through your firewall here. In this case, I'm just going to say it's the CDC website. I don't have the whole link in here. www.cdc.gov in here. Now, if there's a whole link in here, typically what you'll do is go to your web browser. You'll find that link. You'll find that FastFacts website. You click on the link, and then you'll paste the link into here, just making it easier. But I'm going to just use CDC. So now the link shows up down here with the description and this little link button over here. I'm going to go ahead and save that. So the link button, when I click on that, is going to take me to a new browser tab up here, and it's going to take me right to the CDC website. So the idea here is if you have a place that you can go to get the information to update this particular objective, actually it works at the goal level, the objective level, and the activity level. You've got different data sources available. So you can literally have hundreds of data sources in there. But if you've got a place to go get the update, why not have it at your fingertips? That's what we did there. So this is our first objective. We could have multiple objectives, different high schools down here, all different kinds of things. To get to our objectives, again, we're going to have that set of activities in here. I'm going to go to my activities tab. Again, it's blanked out here, so I'm going to open that up. Go back to our template here. I'm going to grab our first activity. You notice I marked them as project-based, QA, and QM. So we're going to go into the details on each of those. Control C, create the training content, go back over here, paste it in, Control V. This is our drop down for activity type. Project-based is our default, so we're going to go ahead and leave it at that. At that point in time, that means we have to come up with a performance metric for a project-based activity. So in this case, we're saying we're creating training content materials. So once we've created the training content materials, Control C, we're done with it. We're going to go ahead and put in a beginning and ending date. Let's just go ahead and use the month of September. So September 1 through September 30th. We'll go ahead and save that. Takes it a second on the first activity. It's doing a lot of calculations in the background here. There we go. So there's our first activity. Our measurement in this case is going to be percent complete. So if I were to go down here and say, okay, completed chapter 1 of 4. That to me indicates we're 25% done. 1 of 4 is 25%. So I'm going to go ahead and save that again. Do we want to update the traffic light? Well, no, because we're moving along the cycle here. It's still on track here. We're just not to the point where we've completed all the chapters yet. So I'll go ahead and leave it as green up here. Now, if I were to put in another note, let's say chapter 2, I might mark this as 50% done and go ahead and save that. Leave the traffic light as is. So now we're 50% done. So this is going to march me through the cycle here. And again, anytime I do that, I want to put a note in here so anybody else go looking at it and say, oh, I see Fred put in this note that says, chapter 2 of 4 is done in there. The next thing we're going to want to do is assign teams of people. So our teams of people here, click on the pencil icon. And again, we're in the tobacco group, so nobody shows up. So to clear out this filter for the group, we just hit one of these 3 little black X's up here. They're all the same. Click that, and it opens it up here. So let's go ahead and pick a couple of folks here. We're going to pick Crystal to be our lead. Now, when I click on the lead column here, it automatically sets them as a team member, and by default, they get the email notification. That's that real-time planning email that will go to Crystal, so she can go back in and update the status of this activity. And then we'll go ahead and assign Aaron and Diane as team members. So they're working with Crystal to build the training content. Go ahead and save that. Now you'll see when they show up down here, the L over here indicates she's the lead. The blue around the L indicates email notifications. So she's the lead and going to be getting the email. And then the T is for team members in here. So that is the internal folks that we're assigning. We can also assign external partners here. Now you guys don't have any external partners in the system yet. So you'll have, on this left side is partner organizations. So you may remember when we did the intro, it was VMSG dashboard was the partner organization. And when I select a partner organization over here, I'm going to have a set of contacts within that organization, or the people who work in that organization. I can select as many partner organizations as I want. And from each partner organization, I can select 0 or more. I don't have to select the contact. I can say it's just the organization, or I can select 1 or more contacts from the organization. So I can have as many partners assigned to an activity as I wanted to. In this case, since we don't have any partners, we won't assign them, obviously. So this is our training content. I'll go ahead and save that again. So this is the project-based activity, pretty complete. Now, a couple of different options. Every activity has got a activity wizard, and it's the little wizard button right here. When I click on that, it gives me some options here. First of all, my dates, they're identical whether I put them in down here or put them in the wizard, same thing, doesn't matter. Data entry type, the default is 0 to 100%, as you can see. And you can see over here we're at 50%. I also have a couple of options. So let's say I'm going to go in this week and I'm going to create the training content. At the end, I just want to check it off as being done. That's what this guy down here is for, the complete. And when I do that, you'll notice the 0 to 100% changes to a checkbox for complete. If it's unchecked, it's equivalent to 0% done. If it's checked, it's equivalent to 100% done. Now, in the project-based activity, when I go to 100% done, you may notice that the traffic light changed to gold over here. And I'm going to go ahead and save that. What that indicates is that we have completed this particular activity. There's also a different option here, yes, no. Now, this not used real often, but if you have an activity that the answer is a yes or a no, then you can say, have you completed the training content? Yes or no. No is 0%, yes is checked, and 100%. So the same kind of thing. So those are different options for the project-based activity. Again, the default is 0 to 100%, and most people will leave it at that, but doesn't necessarily have to be. Okay, so that's activity number 1. Let's go grab activity number 2, our QA activity. Again, Control C, we'll go back here. Now, to add a new activity, I'm going to hit the plus button. Opens up the bottom, as you can see. Control V, provide the 9 training sessions each month. Now I'm going to select this as a QA activity. When I do that, the wizard opens up for me. So you got a couple things to select in here. First of all, our frequency. So you can see it goes anywhere between weekly at the lowest to every 5 years at the highest. We're looking for provide 9 training sessions each month. So monthly is going to be our frequency. Let's go ahead and pick a start date. We'll go ahead and use the same September 1 start date here. We're going to talk a little bit more about this timeline in a few minutes. It doesn't really apply to this situation, but I want to show you what it's all about here. This is where we set the values for the traffic light. So if it's greater than or equal to 9, which is our target, we're going to call it green. If it's less than or equal to, we said 6 was the number here. So 6 is going to be red. And then our metric type down here. In this case, it's real simple. Training sessions provided. So when I hit this button, you'll notice it created the performance metric for me. Training sessions provided, measured monthly, are green, yellow, and red. So that is our number 2 activity. Now you'll notice that the traffic light went to red. That's because we have nothing in there, or 0. If I take this up to like 7, let's say, you notice the light turns to yellow here. When I save it, it sends it up to the server. Now, on a QA activity, every time I make a change after I initially enter it, I'm going to get this dialog. Do you want to update the cycle start date? So remember, we're measuring within a monthly cycle. In this particular case, I've only done 7 of the 9 trainings, so I'm probably going to say no, meaning the cycle start date will stay at 9/1. If I have completed, let's say I've done 7 and that's all I'm going to be able to do this month, I can say, sure, I can set today, the current date, so what is that, the 18th, I can say is the cycle start date, or the most common option is select. If I say select, it's going to give me the next month cycle start date, so 10/1 of 24. I can change that, by the way. I can edit that to anything I want it to be. But I'm going to go ahead and leave it at 10/1 of 24. Hit OK. You notice the cycle start date now moves into October. So that's what the QA activity kind of helps you to automatically move that date forward because you're working within a monthly cycle. And if it was a weekly cycle, it'd move it to the next week. If it's an annual cycle, move it to the next year, so forth. And I think we got through all of, one more option here I want to talk about. Sometimes things are lower is better. The example is a golf score, right? So if I wanted to say I wanted to go a golf score of 3 is green or less. So you notice I flipped the greater than or equal to, it became less than or equal to, and it zeroed out my numbers here. So I'm going to say 3, and if it's greater than or equal to 6, it's red. So what I've done is flipped it around. So I can use lower values equal green versus the higher values. So if I flip that around again, we'll go ahead and put in our 9 and our 6 training sessions provided. And like I say, I'll come back to that timeline option here in a minute. So that is our QA activity. I'm going to say, no, I don't want to update that. Okay, so that's activity number 2. Again, we're going to assign team leaders, team members, and activity partners if we have them. We're going to use notes in here. So every time I do a training session, I'm probably going to put a note in here that I did 2 training sessions today with a time and date stamp, whatever it happens to be in there. And you're going to mark the additional number into here. Our third activity, that quantitative measurement activity. Control C, go back over here, hit the plus button again, paste it in there, Control V, contact all 20 tobacco vendors. Again, our drop-down quantitative measurement is going to open the wizard for us. Let's go ahead and use our same September 1 through September 30th dates in here. And by the way, you can type these dates in as well. You don't have to use the calendar. Easier that way. Now, in this case, remember, we have a target number. We know that in this case, it's 20 tobacco vendors. So we'll put that in there. You can measure decimal or dollar. Decimal is just anything you're counting. Widgets, vaccinations, medications, anything you're counting, decimal. Dollars is exactly that. It's dollar signs and a couple decimal points. This is the activity type that you would typically use if you're counting grant dollars, budget dollars, whatever you're using. Anything that's monetary, you can put in here. So in this case, we're going to leave it as decimal, and we're going to say tobacco vendors contacted. Now, we have a couple options down here. I'll go over those in a minute. The default is enter a value to add to total. So I'll go ahead and save that. So first thing it does is create our performance metric. 20 tobacco vendors contacted between 9/1 and 9/30/24. It put in our beginning and ending dates in here. So I'll go ahead and save the activity here. Now, over here, because I said enter a value to add to total. Let's say at the end of this week, I did 5 contacts. Put that in there. It rolled up to the running total of 5, calculated to be 25% done. Go ahead and save that. Is the light set correctly? Sure, we're in good shape. The next week, let's say I go in there and I put in another 5 contacts in there. Now it sums it up to 10 and makes it 50% done, and so forth. Now, some of the other options that we have in here, let's look at those. We talked about the decimal in dollars. The other down here at the bottom is enter a new total value. So I'll switch to that, save that. Now you'll notice that the roll-up went away here. So it's just giving me a value to add. This is, for a short-term activity where, again, I'm going to go in this week, contact all 20 vendors. I want to go in and say at the end of the week that I did 20 vendors. So instead of rolling up on a repetitive basis here, I'm just going to say at the end of the week I did 20, calculation be 100%, and away we go. Now, there is another option here I wanted to talk about, and that is what we call a zero target. So if I set this back to enter a value to add a total and take this down to 0 and save it, it's going to say still tobacco vendors contacted. In this case, is all we're doing is counting. Since we don't have a target, we can't calculate percent complete. The target is the denominator. If it's 0, you can't divide by 0, so there's no calculation done. But it's just going to keep a running total of how many vendors we contacted. There's a lot of things that you'll do, like you want to know at the end of the month, how many vaccinations did we do? How many medications did we distribute? You don't have a target number, but you want to know. So you just use it as a counting mechanism in here. Let's go back and kind of set that back. So we'll make this, again, 20. And enter a value to add a total, leave it there, so we're all set to go. Okay, so those are the 3 activities that we believe are going to get us to our objective of that 25% reduction. Let's go take a look at that in the pyramid. Okay, so the group was Tobacco 2024. Tobacco cessation was our initiative. The goal we selected was reduce smoking in high schools. One of our objectives was to reduce smoking at Wayne High School by 25% by the end of the school year. And then the activities: create the training curriculum, provide the 9 training sessions a month, and contact the local tobacco vendors. Okay, so that is the plan that we just developed here. Now, I mentioned I want to go back and talk about that timeline activity. Just as a preface, the timeline activity I'm going to put in here has nothing to do with this plan. I just want to be able to show you what the timeline activity is about. It's actually a pretty cool feature. It was developed to manage critical documents. So I imagine you can use it for a lot of different things, but let's talk about that. I'm going to go ahead and add an activity here. I'm going to say update standard operating procedure, SOP 1, annually. So I'm updating the standard operating procedure annually here. I'm going to select that as a QA activity. I'm going to say annual is our cycle. So I'm just looking at annual. And I'm going to check this timeline. When I do that, we just get the one box, percent to yellow. I'm going to go ahead and call this 90% to yellow. So what that says is 90% of the way through the year, the annual cycle here, this light is going to turn yellow. When it does, that says, hey, I'm behind schedule. So the next time the email notification goes out, the person who's designated as the lead on this particular activity is going to get an email to go back in and update this standard operating procedure. So we're going to say update SOP is our metric type. We'll go ahead and save that. So now what we're saying up here is we're going to update the SOP, measure it annually. Our green is if we're less than 90%, this light stays green, 90% of the way through the year. Get to 90%, which is what, somewhere around 11 months through the year, the light's going to turn yellow. Let's go ahead and save this. And I'm going to go ahead and assign, I'll pick somebody randomly as our activity lead. Let's just pick Terry here. So Terry's the activity lead down here. So now, the other thing you're going to want to be able to do is this is where we manage critical documents. So I'm going to leave the start date as it is. Let's go ahead and set it for, let's set it for the beginning of the fiscal year. I'm assuming, I don't know if you guys' fiscal year is July 1, but we'll use July 1 as our fiscal year. Save that again. Now, what you're going to want to be able to do is actually manage a document. So here's document management, this little button you'll see on every screen. You can attach documents anywhere. So let's go ahead and attach the SOP document to this activity. So I'm going to click on that, hit this button to hack it, choose a file. I got a bunch of test files out here. I'll just pick one of those here. We'll call it, how about health and wellness? So our standard operating procedure is for health and wellness. Go ahead and say upload that. I'm going to call this SOP 1. I can change the traffic light. Let's change it to green. I can put notes in here. I can time and date stamp the notes. You notice you have the file name down here, the file size, the current date. So I'm going to go ahead and, let's go ahead and say we've updated or uploaded that file. So now what I've got is the document, the standard operating procedure document that this is related to attached to it. Now, and I've got Terry in here as our lead. So what's going to happen is about 11 months, which would be what, August of next year, this light is going to turn yellow. When that light turns yellow, Terry is going to get an email notification from the system to go in here and download this current document, make the changes to it required for the next fiscal year, upload the new version of the document right to here. It does automatic version control for you, the whole 9 yards. As soon as you do that and you hit the save button, you're going to get that little dialog that says, do you want to update the cycle start date? Yes, you're done. Update the cycle start date. It'll take you to the next year. So it'll take you to July 1 of 2025. The lights all turn green again, and away you go. So think about this. In your department, you probably have lots of policies that have to be updated on a regular basis. You know you've got FAB documents that have to be updated on a regular basis. You got grant documents. You got standard operating procedures. You got memos of understanding. All of those require to be updated. So what you can do is build, what people do, they'll build a group called critical documents. Underneath that, at the service initiative level, you might have one for policies. And then you might have a service for SOPs and a service for MOUs. And then you start building out the plan until you get down to the activity level. And the activity level is where you actually attach the SOPs or the MOUs or whatever it is. And you build the plan to say, okay, we're going to update this on this 5-year basis or annual basis or monthly basis, whatever it happens to be. What you've done now is just automated the whole process of keeping your critical documents up to date. As an added bonus, If you set up that group called critical documents, you can give everybody in the department read-only access to that group. What happens then is they can actually go in and say, oh, I want to go find the health and wellness policy, or SOP in this case. So I go to my SOPs and I take my way down to the SOP for health and wellness that we just looked at. They can download that policy. They can use it. They can't update it. They can't upload a new version of it. Because all they can do is use it. So it gives you a nice, clean, easy place to go to have all of your policies up there. And you can look at the light because, by the way, if this particular one gets to the 100%, meaning we get to the end of the year and it hasn't been updated, the light turns red. And then when you look at the policies, you'll see it's a red light indicating it's out of date. It's a year old. So this is really kind of a cool feature. Like I say, it doesn't pertain to this plan, but I wanted to show you that because it is probably the most used feature in the system right now. So that was operational planning. Now, what I'm going to ask everybody to do is actually go in and for the next session, we're going to create a little operational plan. Most often it's going to be something simple, and I'd encourage you to use something fun that's kind of near and dear to your heart. Maybe, you got a kid's birthday coming up, you're going to plan a birthday party, or you got a vacation coming up, you're going to plan that, whatever you want to do. Or if you want to do something business related, it'd be boring, So typically you're going to have under the training group, you're going to have one service or initiative, which is kind of quickly going to define Fred's birthday. And then underneath that, the goal might be, I'm going to create the nicest birthday party Fred ever had. And then under my objectives, I'm going to have, by the end of September, I will have chosen a venue for Fred's birthday. And then under the objective, you're going to have a set of activities. What do I have to do to choose the venue? I'm going to contact my neighbors to find out what they've done. I'm going to contact the venues to get the pricing, all that kind of stuff, whatever you're going to do. So think about it this way. One service or initiative, one goal, one objective, and potentially if you can find a way to use the 3 different types of activities in there, please do. If not, just use one or more activities in there. Now to do that, I'm going to walk you through the process. It's real simple. You're going to log in, you're going to go to your group screen. Everybody has full access to the training groups. Select the training group here, go to services or initiatives, hit the bottom or hit the plus button, and then type in to decide whether it's a service or initiative. Typically for this, it's going to be initiatives because it's something you're planning on doing. So you're going to click on that. You're going to type in your service, planning Fred's birthday. If you would, in parentheses at the end of the initiative, put your initials. That way, when we go back in to review them, we'll know who's doing what when. After you enter that, you're going to go to your goals tab. After you selected your initiative, go to your goals tab, and you're going to put in the goal of making it the best birthday for Fred ever. So that'll be your goal. You're going to consider you're going to be on track, so probably you're going to be at a green light in there. And then the objectives, again, you're going to pick a venue, you're going to invite people, whatever those happen to be, by a specific date. Now, the biggest problem that people have doing this is at the SMART objective level. So think about those 3 things. Something very specific. I'm going to choose a venue. Measurable, a single venue. So you can say I'm going to choose a venue. And then a timeline by the end of September. So make sure you got those 3 things in your objective. And then the activities are, okay, I've got to choose a venue. What are the steps I'm going to go through to choose my venue? Again, talking to people, getting references, things like that. Maybe using Yelp or something like that to look up birthday venues, whatever it happens to be that you're going to be able to do in there. Put in some activities. So you're going to have a total of about 6 planning elements in here. I would ask that everybody go through and take the time to do that. Once you get in there, literally takes about 5 minutes, but it's part of the learning process, actually doing it yourself. It really, to me, it's always the easiest way is to go in and kind of work my way through it. You're in the training group, so you're not going to hurt anything down there if you mess up, but please feel free to get those in there. We will schedule a follow-on training, and we're going to review everybody's plans in there. So that was all I had for the day. Any questions, anything else you'd like to see? This is the point in time when nobody answers that I think I've drowned you again. So if you don't have any questions, please go ahead and when you get the chance before the next training session, not this afternoon. This afternoon session is going to be just another version of another iteration of this particular training session today for other people here. But we will schedule what we call training 3, which is a review of the operational plans that you guys create. So if you have no other questions, I will let you guys get back to your real work. If you do have any questions, feel free to reach out to Andrea or myself, and we'll get you taken care of.
Yeah, hi, Fred. This is Kelly. Thank you. So I will reach out, but also, how many more trainings are there scheduled at this point for the team?
The next training will be the review. So we call that training number 3.
Yep.
And depending on how many people are on there, we can do multiple sessions. If there's only a couple of people on there who've done the plans, and we'll combine that with training 4, which is performance monitoring. Then after you guys have several plans in the system, typically about a month later, we go into what we call 3-dimensional planning. And that's how do we interlink all those plans together in the system. And then for the folks who are designated as org admins or administrators, there is about a 30-minute session on managing user permissions, managing group permissions, all that kind of stuff in there. So those are the trainings that are available moving forward here.
Okay, that sounds good. I think that'll be one of the next sessions, is that admin training session 2 that you'll want to set up. And then I was just looking at, overall how many total trainings. So that's very helpful.
Yeah.
And then I think, go ahead.
I said the admin training can be done at any time for those folks who are the org admins.
Okay. And I think the thing to make note of is that our goal initially to start is to work with you to get the strategic plan entered into VMSG, and then utilizing VMSG for tracking documents for FAB accreditation.
Yep.
But then obviously we'll be using it for lots of programs and other things too.
Yeah, typically where people start is the FAB 6-pack of plans. Using the accreditation plan, it's built in to manage all your documents and your progress through the accreditation process here. And then over time, everybody should have a plan in there. So you got a community health plan, you got a FEP plan, all the different groups can have their own plans in there.
Perfect. Thank you.
Okay, I will send out a link to the recording here so that you guys can have it. Again, we got another session this afternoon for those folks who weren't able to make it today. Thank you, everybody. Hope you have a wonderful day.
Fred, just want to make sure that you have email address for all of us, or are you going to be sending it to Mike and then?
I will send it to Mike and Patricia. I have their email addresses, and then just have them distribute it to everybody.
That sounds great. Thank you so much.
Thanks, everybody. Have a great day.